question. Maybe that is, yeah. Yeah. Right. So if you have read and understood, considering its surgical pathology station, this 48 years old lady comes to you with a black toe. What provisional and differential diagnosis would you consider for her? She's non-smoker and a construction worker.
Yes, ma'am. The provisional diagnosis would be dry gangrene of
Yes,
right big toe,
yes,
and differential diagnosis would be diabetic foot,
yes.
uh, wet gangrene, or chronic limb ischemia and acute limb
Okay,
ischemia.
good. So how would you confirm your diagnosis?
Uh, I would examine the patients
Yes,
and do the lower limb vascular and neurological examinations
yes,
and calculate the ABPI
yes,
to rule out any limb ischemia.
yes.
And would also run some blood investigations that include CBC, uric creatinine electrolyte, and LFTs and clotting profile.
Good. Can you define the term gangrene for our better understanding?
Yes, gangrene is a type of necrosis that is secondary to the critically insufficient blood supply to the organ.
All right. Now that you've mentioned necrosis, how would you define that?
Yes, necrosis is a type of accidental cell death in which there is the rupture of the cell membrane and leaking out of the cellular content, and that will lead to loss of iron hemostasis.
All right. Right. How would you define necrosis from autolysis?
Uh, Autolysis is physiological and necrosis is always pathological. And autolysis is a programmed cell death. And it could be physiological whenever there is DNA damage, there would be
Is it
autolysis in
is
that
it
scenario.
energy driven? Would you
Yes, it
consider?
is.
All right. What are the different types of cell death that you're aware of?
There are broadly two types of cell death, that is necrosis and apoptosis.
How would you differentiate apoptosis from autolysis?
Uh, Apoptosis is a programmed cell death
Yes,
and it is physiological.
yes.
And I'm not sure about autolysis. Can we skip it, ma'am?
You want to attempt it at the end. All right. Can you please tell me the pathogenesis behind necrosis?
Yes, due to critically insufficient blood supply, the cell overall gets swollen, and it will lead to swelling of the mitochondria as well. There will be influx of the calcium to via the cell membrane and towards the mitochondrial membrane.
Yes,
And when there is calcium influx, it will be the rupture of the mitochondrial membrane and lysosomal membrane that
yes.
will lead to the rupture of the cell membrane as well. So cell death will be secondary to the release of the cytochrome C by the mitochondria.
All right. Can you tell me what risk factors would you consider for this lady that has led to this condition which she has presented with?
Yes, as she is heavy smoker, this is one of
Yes,
the major risk
yes,
factors.
yes,
Other risk factors include the hypertension, diabetes mellitus, and
yes,
dyslipidemias, and
yes.
family history.
Could be family history. What about her profession? Does that have anything to do with her condition?
Uh, Construction worker. I'm not
We'll
sure, ma'am.
consider that. We'll come to that later. Okay,
Okay.
please tell me, how would you classify the term necrosis
Yes,
broadly?
necrosis. Yes, necrosis could be coagulative necrosis, liquefactive necrosis, gangrenous necrosis, fat necrosis, and fibrinoid necrosis.
Good. Can you tell me how would you differentiate between dry and wet gangrene? Considering that, which gangrene would this be?
Yes, dry gangrene is secondary to the arterial insufficiency and the blockade of the arteries, and the wet gangrene is secondary to the venous obstruction. And considering this scenario, this is the scenario of the dry gangrene.
All right. Just suppose you don't get to manage the patient's toe on time. What are the complications that you should be prepared for?
There would be spreading cellulitis of the limb. There could be secondary infection of this toe, and it will lead to necrotizing fasciitis. And there could be autoamputation of this big toe as well.
So, how do you suggest that should be managed or treated?
This
Uh,
patient should be managed according to the CCRIS protocol, according to the ABCDE approach, and this patient should be admitted in the HDU. And the second for the secondary infections, I would prescribe antibiotics according to a trust guideline.
Yes.
And to prevent the secondary infection, this toe should be amputated.
All right. Okay. Right. I want to ask you, who would you involve in the management of this patient?
I would involve intensive therapy unit, general surgeon, and the orthopedic surgeon in this case,
And
and anesthetist,
and what about the plastic surgeon? Would
and the
you?
plastic surgeon. Yes, ma'am.
Okay.
For
Right. Can you quickly tell me the differences between, or you've already told me, the differences between dry and wet gangrene?
yes,
Does it have to be like site mechanism, macroscopy,
yes, yes.
and yeah.
The most common site of the dry gangrene is the limbs, and most common site of the wet gangrenes are the bowel, gastrointestinal tract. The pathophysiology includes arterial insufficiency in dry gangrene and venous obstruction in the wet gangrene. There will be clear line of demarcation in the case of dry gangrene, and will be no demarcation in case of wet gangrene. There will be a high amount of bacteria in wet gangrene, and the bacterial content is very low in the dry gangrene. Uh,
The
Other than
prognosis?
Yes, the prognosis of the dry gangrene is better and the wet gangrene is worse.
All right. Okay. Right. You said in your investigation you'll also ask for lipid profile. Why? Can you justify?
Yes, ma'am. As there is the history of dry gangrene in this patient, the other risk factor could be dyslipidemia that causes atherosclerosis.
All right. Can you define atherosclerosis?
Yes, atherosclerosis defined as the lipid-like accumulation or fat accumulation in the wall of the arteries that will lead to decreased diameter of the arteries and lead to decreased perfusion of the limbs or any organ.
Okay. Right. One more thing. What are the risk factors for atherosclerosis?
Yes, there are two types of risk factors that includes non-modifiable risk factors and modifiable risk factors.
Yes.
Non-modifiable risk factors include the age, gender
Yes.
of male, family history.
Yes.
The modifiable risk factors include hypertension, diabetes mellitus, dyslipidemias, smoking, and recurrent.
Okay. Right. Yes. Time gone. Thank you. Thank you.